Hi there, I'm Dr. Heather Harrison. I'm a family physician at the Central Utah Clinic in Provo, Utah. Today we're talking about how to get pregnant with endometriosis. So endometriosis, just to review what that is to begin with, is basically part of the uterine lining that's called the endometrium. It gets onto other parts of the pelvic organs, including on top of the uterus, on the fallopian tubes, the ovaries, sometimes can get on your bladder, rectum, and other areas within your pelvic floor. A lot of times women with endometriosis will have severe pelvic pain during their periods. The problem with that endometrial tissue that gets out into the pelvis is it can cause scarring within the pelvic organs and affect your fertility. It can scar down your fallopian tubes so the egg and the sperm can't meet up with each other to fertilize and implant. So a lot of times with endometriosis, treatments that we'll do include putting you on birth control pills to regulate and prevent periods, to prevent the endometrial tissue from building up in the pelvic floor. There are other medications like Lupron that kind of puts you into a temporary menopause that will help to prevent the endometrial tissue from building up. And sometimes we go on to laparoscopic surgeries to remove that tissue to improve your fertility. In regards to the best ways to get pregnant with endometriosis is make sure that you're following with your physician if you're having difficulty. If it's been more than 6 months that you've been trying to get pregnant, I would probably recommend following up with your physician for further testing to see if there's anything that you can do to help to improve your fertility with opening up fallopian tubes, decreasing the amount of endometrial tissue that's there, causing scar tissue. But the best thing is make sure you have a physician that you're working with and that you're controlling your symptoms and timing intercourse appropriately. That's Dr. Heather Harrison talking about ways to get pregnant with endometriosis.